Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Mahesh Koregan. He is an expert in IVF and infertility specialty. And shortly he is going to be the president of Bangalore Obstetrics and Gynecological Society. And apart from that, he is working in the national strategy as a director of Nova IVF Fertility based in Koramangala. And he's well known in Bangalore and in and around places. And today he is going to tell us why this infertility occurs, why more and more people are coming for the infertility treatment, what are the causes for that, and how to avoid them. Please tell us, sir.
Thank you, madam, for inviting me for this program. And I'm very happy to be with Dr. Vijay Lakshmi, madam, who is one of the very well-known persons in this field of medicine. And I'm honored to be with you, madam, today on the show.
Thank you.
Yes,
Thank
to come to the question proper, today a lot of people are getting married late. So the earlier days we were getting married earlier. Now they are getting married late. So what is happening because of the late marriage? The eggs are coming down, the sperms are coming down, due to which the fertility is becoming little difficult than before.
Okay.
Earlier, by 20 years, people are married. Now, even after 25, most of the people are not married. So, but
Even
then
30, 35, they're still not married.
yes. So what happens is body doesn't wait for us. Body goes on its aging process. So that's why we see. So that's why we ask them to have at least egg freezing done. We have option of egg
Okay.
freezing. So even we freeze the eggs for many people because many have education to complete, career to complete. Yes, we respect all that. But then these are the reasons that is happening. And second is the lifestyle changes. People are eating a lot of junk food today and they're not
And the
exercising.
obesity is increasing. Almost
Obesity is
30%
increasing.
obesity has
Yes.
increased.
Especially
Yes.
in women, there is a polycystic ovary. Along with that obesity, it's a vicious cycle. One after other, it goes on like that. So that's the
Yes.
reason the infertility is increasing because of the lifestyle problems also. We were thinking that in villages also the people are healthy. But if you see farmers, sperm count are very less because they are using pesticides. They are using a
Ah,
lot of fertilizers.
yeah.
So
Pollution in the water
everywhere,
and the environment and the
everywhere.
food, all are contributing. Yes.
Pollution is now you are counting AQI every day. How much is the air quality index in Bangalore,
Yes.
Delhi?
Yes.
How much
Yes.
is the water pollution? There's a groundwater pollution with pesticides, and there is in what food we eat also is laced with pesticides. There is farmers who is spraying also is affected by this. So in
Yes.
farmers also we are seeing the sperms counts. That is the Dhatu Viranu count is very less. So these are worrying trends because of which the pregnancy is not happening. Low sperm count and low eggs and lot of lifestyle issues. With all this, we are seeing lot of changes than one generation before. That why the pregnancy is getting more and more difficult.
Okay, okay, sir. Now, do you think even this, apart from the lifestyle, they indulging and into tobacco and alcohol consumption, is it also playing a role?
Yes, madam. You brought up a very good question. People who smoke or who chew tobacco, gutka, kaini, jarda, mawa, anything, all these people will have lot of sperm issues. Either the low sperm count or the motility of the sperm is very less. So they have a lot of problem in fertility. Even today, lot of people are sexually active before they are married. So when they're sexually active, some dangerous sexual practices like
Diseases
the
can come.
with the
Yes, sexually
diseases like the
transmitted
sexually
diseases.
transmitted diseases also we are seeing, which leads to pelvic infection and tubal block. It's called as PID, pelvic infection. There is a tuberculosis, chlamydia. There are a lot of other sexually transmitted diseases which can happen. A lot of young people are losing their fertility potential because of these habits, along with men also smoking some form of a tobacco and again altered lifestyle. All these are causing the infertility problem, which is more exponential, too much than before. Now, 1 in 5 couple are struggling to conceive. Such is the magnitude of infertility now.
And not only smoking and drinking, sir, and nowadays men are not sleeping at all. The whole night they
Yes,
are awake.
the stress,
And
the
that
stress.
screen time has increased and the stress is increased. And that
Yes,
also is the. And somebody was joking, the only problem between the two was the husband is not sleeping. He is there with the mobile all whole night. And that's
Correct.
how, jokes
Correct.
apart, in the
True,
past,
true, true.
people used to go to the temple and go with the wet cloth
Yes.
and
Yes.
pray for it. But now the technology has advanced so much. What are the new technologies that are there, and how do you give them the solutions, all the
Yes.
problems?
Yes, this is very important. See now, earlier IVF was the only option. Today,
Hmm.
we have first technology is ICSI, intracytoplasmic sperm injection.
Hmm.
So some men have very less sperms wherein the pregnancy is not possible naturally or by any smaller treatment like IUI. We have technology wherein we can take the sperm, inject in the egg, and create an embryo. So it's a boon
Oh,
for those men who have less sperms. That is number one.
okay.
Number
Okay.
two, some people have no
Azoospermia.
sperms,
Hmm.
azoospermia. In
Yeah.
them, we have technology wherein we can put a needle and take out the sperms.
Whatever few
They don't
sperms
have
are there,
to.
you take and inject.
Yes.
Yes.
Even there
Very
are
nice.
few sperms, we can do the intracytoplasmic sperm injection ICSI
Yeah.
into the egg, and
Yes.
these people
Yes.
can become fathers with their own sperms. Earlier, these
Hmm.
people were
No,
advised that
no,
donor
no.
sperm.
Earlier, these people, they used to, without realizing, the family
Yes,
people will go and get another girl for the
correct,
marriage. And now
correct,
that is
correct.
not a problem.
That
Or
is, yeah,
in that
now,
case, the
yes,
doctors used to catch hold of some ward boy and get the semen and then inject. No, all those things are gone now. Now we
yes, yes,
have a better technology and better resolutions for all the
correct.
problems.
Now these
Yes,
are the
sir.
best technologies that
Wonderful.
can happen. And these
Very
men
nice.
without sperms, azoospermia also, we are taking the sperm and we are doing it. Even
Yes.
with the women who have less eggs, we are able to
Hmm.
take it and we
Hmm.
can rule out any abnormality and we can
Hmm.
do a ICSI and we can
Hmm.
do a genetic testing of the embryo. Earlier, there was no
Okay.
option. If there is an abnormal baby like a Down syndrome or a
Hmm.
mentally retarded baby, we didn't know what to do to prevent the
Hmm.
next baby.
No, we
Now
used
we
to
can do the,
terminate the pregnancies, otherwise they used to
yes,
abort themselves, or
yes,
they used
yes,
to be born with the heart diseases and then
yes,
suffer the whole life. So now
yes,
even that can be avoided. Excellent, sir.
yes,
Very nice.
yes.
Hmm.
So this is the technology wherein we mix the egg and sperm by IVF route and the
Hmm.
ICSI route, and then we send the
Hmm.
genetic testing, the one sample of the
Hmm.
embryo that is called embryo biopsy. We take a
Hmm.
small piece
Oh
of the
my
embryo and
God.
send it for a
No,
genetic testing.
embryo itself is so small and you are taking a
Yes,
biopsy of
it is
that. That's
microscopic. It is
wonderful.
microscopic only we can see.
Yes.
It needs a lot of expertise, and we
Okay.
test whether this embryo has any problem, and a normal embryo
Wonderful.
is placed into them, and this will give us a good, healthy baby. So that is the new technology which has come. Other than this, a
Okay.
lot of technologies to take a better sperm, better
Hmm.
egg. With this,
Hmm.
we have a good 3D ultrasound and
Hmm.
some hysteroscopy and all those
Hmm.
tests which are helping us to identify the problem, and
Hmm.
this is helping them to have a healthy baby with advanced technologies.
Okay. And in case the woman has got some abnormality genetically in the uterus, that also you can correct it beforehand.
Correct. So
Yes.
if there is by birth, there are some defects like septate uterus. So there is a
Hmm.
wall in the womb. So that
Hmm.
womb wall, we can correct it by doing a
Hmm.
histoscopic procedure. So
Hmm.
these are the many surgeries that we do because there are many people, many women,
Polyps or fibroids, anything
yes,
are there, you
polyps,
can remove
fibroids,
that.
who are suffering and we can be corrected and
Okay, sir. And if there is any tubal block, what treatment do you give for that?
yes, if there is a tubal block, there are two
Hmm.
options. Some people they have tubal block because of infection, or some people would have undergone surgery after completing one baby and they want. We can try to
They would
reopen
have
the
undergone tubectomy and they want to
tubectomy.
conceive again.
Yes, they
Yes,
want to
yes.
conceive again. With them, we open the tube. That is one
Hmm.
option. If the
Hmm.
tube is badly damaged, then IVF or ICSI, what I told, taking the
Hmm.
eggs and sperms and mixing and making embryo is the best
Hmm.
option in these people if the tubes are really not good.
Okay, okay. Ultimately, for the youngsters, what advice do you give them? One, two, three, four in
Yes.
priority. Please tell us that.
Yes. My sincere advice for youngsters is do not indulge in any bad habits like
Yes,
tobacco based, either
yes.
chewing tobacco or smoking tobacco, that you please be refraining.
And
It
in
affects
fact,
a
the
lot.
Baltimore study has shown if they chew or smoke, the right side of the heart will be damaged. So even if they get the children, the right side of the heart of the baby will be affected. And for
Yes.
us, cardiologists, it becomes very difficult. And if they take drinks, they'll have ventricular septal defect or transposition. So correcting that also will be a difficult task. So
True,
better
true.
keep away from the bad habits. Yes,
Yes.
sir. Agreed.
Yes. And number two, do not indulge in unsafe premarital sexual relation, because
Yes.
unsafe relations lead to lot of problems. Sometimes if you're not safe, not only a pelvic inflammatory disease, tubal block, also unnecessary abortions leading to threatening your own life, ectopic pregnancy, and apart from this, there are life-threatening diseases which you should not be transmitting into you from somebody. These are all to be avoided before marriage. You should be very careful about these things. Third is, if you have a repeated history of miscarriage or a less sperms or a less egg, you can always go to the your fertility doctor and request them. There are specialties available. There are services available which can be corrected with a minimum interference and minimum invasive. Most of them don't need to open up your abdomen or anything like that. So nothing to worry on these aspects, and this can be easily corrected. So number four is, always maintain a healthy lifestyle. And
Correct.
if you are having some career, especially women have some career goals, it's better to freeze your eggs. You freeze the eggs, oocyte freezing, and later they can
And
get
use
pregnant.
them later on.
Use it later whenever you are ready for marriage or having a baby. That time you can use this. So you can freeze your eggs. So this is advice for aspirant young ladies who wish to complete their career.
Thank you very much, Dr. Mahesh. Sir. You know, the stress may be the cause for the infertility.
Yes.
But
Yes, yes.
infertility should not cause the stress, because we
You
have
are
an
right. You are
expert
right.
like Dr. Mahesh who is going
Thank you.
to overcome any problem that you have, that he has a solution for that. So thank you very much, sir.
Thank you,
for that.
madam. Nice to have a session with you. Thank you.
Thank you.
Thank you.